Hey everyone, what's up? This is Dr. Charlie PT. Hope you are doing well wherever you are. Appreciate you checking out this channel. And in today's video, I want to talk about how orthopedic spine specialists, orthopedic docs, are not specialists. All right, they're not so special. All right, now obviously there's a caveat. They are specialists in a very specific area, but not in the way maybe that you think. All right, so real quick before we dive into this topic, again, my name is Dr. Charlie. I'm a physical therapist. I have my orthopedic specialty as a physical therapist, so I'm a board specialized orthopedic PT, and I help people all around the world with back, butt, and sciatica pains learn to fix themselves naturally using the power of their mind and movement as medicine. So when I say orthopedic spine specialists aren't specialists, what do I mean? Well, if you're watching this, you have some type of back, butt, and or sciatica pain, which is, again, my specialty. It's what I help people all around the world with, within the realm of PT, right? I'm not doing surgery, I'm not giving shots, I'm not prescribing pills. I have lots of people reach out to me and they kind of see orthopedic specialists at the top of the totem pole, right? So it's like you've got, personal trainers, maybe massage therapists, chiropractors, PTs, right? And then you've got like the orthopedic doc, the neurosurgeon, right? But we're all actually on the same level playing field. So a lot of people, again, they might reach out and they may say, well, Dr. Charlie, yeah, I'd be interested in solving this naturally. And I want to solve it naturally, but I'm going to go see the orthopedic doctor, the neurosurgeon, the spine specialist. And I think what you may want to remember and or understand is that they are a specialist within their area of orthopedics and a very narrow focus, all right? So to put that more cleanly, because it didn't come out very clearly there, they are an orthopedic specialist, and they are a spine surgeon, but they specialize in surgery, right? And so I used to teach at the University of Southern California, and I used to do sort of triage, meaning I actually worked alongside one of the spine specialists, and I would actually go in and chat with people, and the entire intent of the conversation when somebody was at the orthopedic office or the spine specialist surgical suite or center was really just to determine if people needed surgery and or shots, or the surgeon wanted to know, Charlie, do you think you can help them? Right? And so my role as an orthopedic PT, working right alongside the surgeon on the same level playing field, we just have kind of different specialties in that I understand movement and the psychology, so movement and the mind, and how to teach people how to use those things as medicine to resolve things naturally. But the spine specialist understands that what they do is surgery, and that's what they do best. All right? And I think that's something that the public maybe isn't very aware of. Now, it maybe sounds obvious when I say that, but it's like, if you want pizza and you go to the taco truck on the side of the road, don't be upset when they offer tacos, right? I wanted pizza. Well, you came to the taco truck, right? And so if you already know that you want a natural solution to your problem, then does it make a whole lot of sense to go to someone who offers pills, shots, or surgery? Because that's their specialty. And so orthopedic spine specialists are specialists, they're surgical specialists, yes, within a certain orthopedic area of focus. Spine specialist would be in spine, neurosurgeon, as it relates to the nervous system. Again, they can do spinal injections, things like that. And so you just have to ask yourself, are you headed to the right restaurant? Right? And is one better than the other? To bring up this point, I can't tell you how many people go to the orthopedic spine specialist because they're better, but they're not. They're better at surgery, but they, the orthopedic spine specialist, the orthopedic doc, neurosurgeon, gives you a sheet of exercises to do and says, hey, try these out. But that would be like me as an orthopedic specialized PT within the back, butt, and sciatica sort of niche, I'm a spine specialist, but I'm on the movement side of things and the mind side of things. So a spine surgeon, an orthopedic surgeon, giving you a sheet of exercises would be like me doing surgery on you. Now you might say, no, they're completely, it's crazy, man. You could give someone the wrong exercise and make them 10 times worse. You could do a surgery and make someone 10 times worse. Well, surgery is more complicated and it's more this or it's more that. For real, right? It's like your plumber and your electrician. Maybe they get some construction stuff. They're in the trades, right? But you don't ask your plumber for electrical advice. You don't ask your electrician for your plumbing advice, even if they kind of think they know or they're kind of working on the same house, right? And so be careful who you get your advice from. Ask yourself, does this make sense? Is this something that I'm looking for? I've got pill shot surgery and or motion mind, natural treatment. I can go to someone and I can rely on them to fix me, or I can learn to fix myself. But going to an orthopedic doctor when you know that you don't want surgery, you can always check out one of my other videos too, like the 4 times when you need to see a spine surgeon. If you're like, well, what if I do? Check that out. I'll link it above. Okay. Going to a spine surgeon when you already know that you don't want surgery or what they have to offer is like going to Pizza Hut when you know that you want tacos. All right, doesn't make much sense. And then, if you're getting exercises from your orthopedic spine specialist, realize that they have no idea what they're doing when it comes to prescribing exercise. They're prescribing a medicine that is not within their scope, I would argue. All right? They don't understand how to use movement as medicine. They don't understand the psychology of pain, most of them at least. All right, so do your research here. Again, them giving you a sheet of exercises and telling you what to do when it comes to using the movement system. By the way, they have no education on that other than, the knee bone connects to the hip bones and some of the anatomy. They don't understand rehab. They don't understand dosing and prescription as far as strength and conditioning principles, progressive overload and all these fancy terms. And I know maybe you don't either. But the point is that their expertise is not teaching people how to use movement and or their mind as medicine. And if that's what you're looking for, then just, should you really be going there? Or should you be going to someone, maybe like myself, or maybe someone else that you trust, right? Who's specialized, orthopedic specialist still, but not in spine surgery, but in teaching people how to use their mind and movement as medicine, teaching people a natural approach. Again, a spine surgeon giving you a sheet of exercises is kind of like me, as an orthopedic specialist, back butt sciatica specialist, giving you surgery. You'd be like, hey, don't do that. That's a bad idea, Charlie. You're probably going to screw something up. But as soon as the neurosurgeon, as soon as the orthopedic doctor tells you anything, you accept it to be the law because they're up here, but they're not. They're on the same level playing field. We're all on the same court, trying to help people with these very painful problems get out. All right? So the next time you're kind of thinking there's this hierarchy, and you think, well, this is the boss, this is the smartest person, realize that they're just specialized in their own little area. I have my specialty, they have their specialty, they have their own place, I have my own place, right? And so just make sure that you're not barking up the wrong tree. Make sure it aligns with what you're looking for, and make sure you go into it with the right expectations, all right? Don't be surprised if you go to the orthopedic spine specialist who only has the scalpel and maybe a reflex hammer and some shots and the ability to write a script. Don't be surprised if they offer you pill shots of surgery. All right? And please know if they offer you exercises, they have no idea what they're talking about. All right? Because that's not what they specialize in. All right? They're not a specialist in using the mind or movement as medicine. All right? So that's all I got, everyone. Hopefully this was useful. By the way, if you are interested in trying to figure out the most likely source of your symptoms, so you don't feel like you have to go see a spine specialist just to get an MRI and or a diagnostic injection and or a surgery that maybe is unnecessary. Just got off the phone with someone who just had a hip replacement. but it was their hip. But it wasn't their hip, sorry. I burped in the middle of that. It was their back, right? Or somebody who had a back injection, but really it was their hip all along. Most of the time, you don't need injections for these things. You don't need surgery for these things. You don't even need x-rays or MRIs. A lot of times, you can check it out. Better than an MRI DIY diagnostic guide, you can figure this out with a little bit of your own education and guidance, all right? Skip that diagnostic step in most cases. Let's start talking about solutions. What do you want? Pill, shot, surgery, and or motion, a natural approach, as well as the mind. And you can go to someone and or you can learn to do it yourself, and you absolutely can. All right, let me know your thoughts in the comments. Hopefully, this was valuable. Thanks.